Hi, I'm Dr. Paul. Welcome to the Dr. Paul Show. Today I'm going to talk about PTSD. Before I get into it though, please press the like and subscribe button to make sure you're getting all the up-to-date information. So today with PTSD is something I see a lot of in my practice. I work with a guy who works with the VA. So for over many years, I've seen a lot of veterans who come and see me, some from the Vietnam War, some even from the Korean War. So people in their 70s and 80s, and some more recently with Iraq, Afghanistan wars over there. And not only that, even people who are not even deployed, but are, I saw a guy recently who, during training with the Marines and never got deployed, and during his training he just had multiple injuries, and so many injuries to the point he had to retire from the Marines. He was hoping to be a vet. He was hoping to be a career a military guy, and he had to withdraw because his dream of becoming a pilot was gone, and so he's very traumatized by what he went through. PTSD comes out in a lot of different ways. Some of the cases I see are people who've really seen some horrific things. For example, there's so many examples I could say right now, but people who see other people being blown up, body parts flying, people being killed, a truck hitting a landmine and people legs being blown off, and it's just a lot of just horror. When they say war is hell, it's true. It's terrible. Some of the stories I've heard. I mean, some of the stories have really brought me to tears, and so sometimes it's really horrible things, and sometimes it's just being there and being frightened. And so there's some, for example, a lot of people back then, the Vietnam War were drafted, and so they didn't want to be there, and they were forced to be there. And some of them said, I was afraid every day that I was going to die. I didn't want to die, and every day was a struggle for me. And they say, and I see one of my friends dying, and this person dying, and it's like I think I'm going to be next. And so what that leads to is a lot of problems. And it's not just in PTSD. We classically think about wars. It used to be called shell shock, but there's a lot of also PTSD from other things. Victims of crime, people who almost murdered, people who are raped, and also people who witness crime. So people who are to see horrific things. Sometimes that's it, and PTSD from people who have horrific childhoods. They're victims of child abuse. There are people who are victims of, probably the worst I see is childhood sexual abuse. A child being exposed to rape, and that's sometimes really difficult to ever get over, really. And then and there's neglect, there's physical abuse, there's emotional abuse. Another modern example of PTSD is the LA fires. A horrific event that thousands of homes were lost. I think 39 people died. The worst event, the worst fire catastrophe in history, I believe. And so people who have lost their home, they've lost everything. And think about, when you lose everything, all the memories, all the pictures, the things you'll never get back again. You lose your house, you lose everything. Some people have lost their pets. The worst, obviously, is the loss of life. But even people who got out of the fire, which is most of them, thankfully, extremely traumatic to lose everything. Some people have no insurance on their home, so now they're financially destitute, and there's really they feel like they have no hope. So, but even people who've gone through such horror, still, believe it or not, can feel better, with treatment. And again, like I said, I think some people feel guilty about that. They say, I don't think I want to feel better because, if I feel better, it takes away from what I went through. I go, no, it doesn't. I said, because there's nothing to take away from what you went through. But what this did to you is it shocked your system. And when you have a shock to your nervous system like that, it throws your chemistry off. One of the three main causes of these imbalances in the system is trauma. And genetics is a big one too, but trauma is a big one. And so people who are totally fine before, when they go through a trauma like that, can really be extremely depressed and very anxious and panic attacks and nightmares and all of the symptoms of PTSD. Flashbacks, all of that. So yeah, my daughter lives up in LA. Thankfully, she wasn't close to that, very close. But even she evacuated with other people, but I know patients. I have some patients who've lost their homes, and I have patients who know people who have. So. Anyway, that was a very, very sad, tragic event. Another very common, another example of PTSD. There's a lot of different things, and so what it leads to is a lot of dysfunction in life, and this can lead to a lot of nightmares, a lot of problems with sleeping, flashbacks. So flashbacks meaning that the person's like reliving the experience again, like it's really happening. There was a case that I saw of a guy who was in Vietnam, and another soldier had come up to him, and he took out of his pocket something like was shriveled up, and the guy said, "Well," he goes, "This is So this guy had hacked the ear off of a Vietnamese guy, and he was carrying around this guy's ear, and he was it was such a visual shock to him that he never really got over this. And so he's an older guy now, and his wife brings in a fruit basket. So when someone gives a fruit basket, the ones that have like maybe dried nectarines and when he saw that, he started to yell and scream because that visual reminder of that ear, and he yelled at his wife, "Take that basket away! Please don't take." And he said he went to the other room, he slammed the door, and he said my wife never asked me about it. I said I wouldn't talk about it, and so just something like that, as a visual cue of something. Another example is that a lot of people who've been in war, they can't handle seeing any movies about war. They can't read anything about it. A lot of people just say they wherever they're going, they're always looking around. They're suspicious. They're looking for threats. A lot of people tell me that on the 4th of July with the fireworks, they can't handle it. So the one guy told me he would get earmuffs. He would get these earmuffs put over his ears on 4th of July so he couldn't hear it. And so even just any kind of a reminder, it just brings them back. And sometimes, the spouses will tell me that he'll wake up in the middle of the night screaming, and sometimes the spouse even gets hit or pushed because the person is coming out of a realistic nightmare and thinks that she's the enemy. And so, so I've seen this. Sometimes this one woman said that she sleeps in a different bedroom now because of that, because his nightmares are so horrific. So again, PTSD is a really tough thing. The great thing that, what I see when people come to see me, some people have been suffering for 50 years and they've never quite ever gotten better. So when I bring up when I bring up treating them, and I tell them, I can help you. I can get you feeling back to how you felt potentially before you went over there. And the problem is with some people is getting them to accept treatment, because a lot of men especially, they have that soldier mentality. They don't want to display signs of weakness. They think taking a medication is a weakness. And so, but sometimes I convince people to try to treat it, and amazing some of the results. If you watch my show, you've seen you've seen some of the videos we've done about some of the veterans I've talked to, and some of the examples. But yeah, it's amazing. What really I really enjoy treating these people, because when I see someone who's been suffering for so many years actually get better and actually feel happier, and actually their stress level goes down and they're able to handle things better, it's really satisfying for me to see people who've given up so much for our country to be able to give something back to them is very satisfying for me. A lot of times it's not just medications. A lot of people, they need therapy. The best type of therapy for trauma, for PTSD, is we call EMDR therapy. It's a specialized type of therapy that takes people back to that time. So it's a very difficult treatment to get through. The therapist has to be trained to do this type of specialized therapy, but it's the number one most effective type of treatment for PTSD is EMDR. It's called eye movement. Something that has to do. I can't remember the full what it all stands for, but right now, but I've seen it work really, really well for patients. So anyway, but again, it comes in many forms, not just the war, but like I said, there's so many people who go through trauma. Sometimes even, it's obvious the loss of a loved one. Sometimes the loss of a loved one is very difficult, and people go through a very traumatic time. The most traumatic thing a person can go through is the loss of a child. So if someone's lost a child, that's something the person really never gets over, and that's the most significant loss a person can ever have in their life. So, but thankfully I've seen with some patients who've gone through that horrific event that they can still even feel better. Surprisingly, sometimes people feel guilty feeling better, which sounds odd, but some people think that I deserve to feel this way. If I feel happy, there's something wrong with that, because there's no reason I should be happy. So when I can get to a person and say, that's not true, what you've gone through is horrible, and I feel terrible for what you've gone through, and I wish I could take that away, and I can't. But one thing I can do is I can get you feeling better, and with what I do, and that's my job. And thankfully I have very, very good results with treatment of PTSD. So if you know anybody who suffers with this, please refer them to me. I'd love to talk to them about it. If you like what you see with this video, please share this with your family and friends. And please, if you have any questions or comments, if you could send them my way, I respond to every one of them. Thank you for listening. And please, like I said, also share this with your family and friends. Thank you.